Hello, this is NoVA Weekend Warriors, and I'm your host, Meg Donnelly. I'm a licensed massage therapist and mobility coach, and also your TV host today. I'm really excited to share a wealth of information on health topics, fitness topics, all within the Northern Virginia area. And today, I'm very excited. It's our first episode back in a couple of years, and I have a wonderful guest as a result of that. So today, I'm here to welcome Dr. Lina Kazi.
Thank you so much. It's an honor to be here, and I'm super excited to do this.
Excited to have you here. Dr. Lina Kazi is a physician specializing in lifestyle and obesity medicine. She is the founder of Thrive Lifestyle Medicine, where she helps women lose weight safely and sustainably, often reversing chronic diseases through a combination of medication and lifestyle changes. You're also the founder of Thrive Center in Fairfax, a unique women-only co-working and wellness space that brings together community, healing, and entrepreneurship together under one roof. Now, today, we are going to talk something that's very near and dear to my heart, and that's body autonomy. And so I'd just love to hear from you kind of what body autonomy means to you and how you bring that into your practice.
Yes, absolutely. So body autonomy, it's so important to me because as a physician, as a healer, and we're both healers, we know that our clients or patients know what's going on with their bodies. They are very in tune with their bodies. So for us, I feel like the best service we can provide for them is to meet them where they're at, listen to them, listen to what they're complaining of, their symptoms, how they're feeling. Are they fatigued? Are they having pain? They know what's going on with their bodies. And our jobs are to inform them and have a shared decision making in terms of what to do next to help address those symptoms that they're having. So it's so important for patients to understand that it's safe to them. It's safe for them to talk to their physician or massage therapist or any healer about what exactly is going on and really push for whatever they feel may help.
I love that so much. So I just want to say that there's a couple of things that you touched on that really warms my heart and really means a lot to me. The first thing is listening. I don't know if you feel like this, but a lot of times when people have kind of been through maybe some more traditional places, they felt like they never had a chance to kind of tell their story or kind of talk about how their symptoms feel to them. And I feel like just sometimes for me, I don't obviously prescribe or diagnose, but that's sometimes the first time someone's had an opportunity to really explain what's going on in their body and how it feels to them. I know you spend a nice amount of time through consultation and through appointments. Do you find the same thing?
Absolutely, and it's actually one of the first things they taught us in medical school is just listen to your patient's story and they will tell you what's wrong with them. You don't have to guess, you don't have to look at lab work, you don't have to look at imaging. Just listen to your patient and they'll tell you exactly what's wrong and they'll even give you the treatment option in many times. And unfortunately, in a traditional setting, there's very little time that a physician has with their patient. They may have 2 minutes per patient, so that patient, there's no way they can tell them, what's been going on and how long it's been going on and everything associated with that symptom. So by giving them time to just listen and hear from them and learn from them, it makes my job very easy, to be honest.
Yeah. I have a blog post that I had created that was kind of talked about guide by the side instead of sage on the stage, right? And so it's really just kind of like adapting to find out what works for someone, what isn't working for someone, and meeting them where they are. And I think you said that earlier, right? Meeting them where they are to take them where they want to go.
Absolutely, absolutely. Because everybody is on their own journey. So you're going to meet them wherever they are in their journey. Some people are just starting out. They haven't done anything for their health. So you're going to be doing a lot of legwork with them, as opposed to someone who has been working on their lifestyle changes, on their diet, exercise, stress management. Then maybe there's a little less legwork, but some guidance that they need. So each person is individual, and like you said, you just meet them where they are and take it from there, and that leads to better outcomes.
Yeah. A lot of times when we talk about body autonomy and body positivity, people automatically think that that does not include weight loss, but there are people that do want to come and want to explore what those options are. And so I know for me, it's not about my preconceived notions and my bias on whether or not, you do or you don't, but it's helping someone that's, if they've decided to go on that journey, what are the resources they can use and kind of how can they go through that process in a safe and comfortable way. Do you kind of feel like that's on the right path of meeting someone, or how would you kind of have me adapt or change a little bit about how I'm kind of thinking of those goals?
I think just having an open conversation and not being judgmental, which I would never think that you are, thankfully neither one of us are judgmental when a patient comes into the room, but really just having an open conversation with them. Are you comfortable discussing your weight? And some people will say no. They'll be very honest. No, I'm not comfortable. I'm not ready to discuss my weight right now. I don't think it's a problem. I'm not having joint pain. I'm not suffering from fatigue. I'm a very mobile person. I'm very comfortable with my body and the way that I am. And then others, if you just open a conversation with them, they may say, yeah, actually, do you have any ideas for me? What's worked for some of your other clients? And so just really having that two-way street where they feel comfortable to talk to you and open up with you and not be judged.
Yeah. A lot of times we put so much focus, or even some of our health professionals may put a very big focus on weight, but we know that weight isn't indicative of health. And we have some factors that, have kind of rolled into the industry over the years or rolled into insurance over the years, like BMI, that aren't actually like the best factors for measuring whether or not someone is healthy. Would you like to expand on that a little bit, or kind of talk to a little bit about how weight doesn't necessarily equal health?
Yes, absolutely. This is such a common misconception that, the BMI is an indicator of health. And if you have a very high BMI, that means you're obese and very unhealthy. If you have a very low BMI, that means you're at the epitome of health. There's no correlation. There's very minimal correlation, let me correct myself, between BMI and health. These are just numbers. They're a great screening tool. It does not account for your body composition. It doesn't account for the body fat percentage and your muscle mass. A better indicator of some of these numbers is a DEXA scan. So that's one of the best ways to take a look at, okay, what percentage of my body is fat and what does my muscle mass look like? So a DEXA scan is an excellent tool. But again, we have a lot of traditional practitioners who will look at a BMI, not really look at their patient and say, oh, you're obese, you need to diet and exercise. Whereas the patient may be very muscular, very bulky, and they have been dieting and exercise maybe to an extreme to where they have such a big muscle mass that it's causing their BMI to be higher. And they're at the epitome of health, but their BMI says they're obese. And so there is a lot of improvements that can be made, and we are continuing to make in terms of finding better screening tools that are indicators of good health.
That's great. So you mentioned DEXA scan, and I think my familiarity with DEXA scan is I'm 50 now, so I'm not quite ready. I think I have maybe another 5 years. I don't remember what the number is, but I'm used to it more for bone health. Is it the same scan? It's just using the numbers in a kind of, the way that you're taking apart the reporting?
Yes, yes, absolutely. It's the exact same scan, and it's just read differently, but it does provide all of that data.
Oh, wonderful. Yeah. I do agree with you. I think that there's so many people that have underlying diseases, whether even including like type 2 diabetes, and they're told, like, come back to me when you get your weight down. Your BMI says you're obese or overweight. Come back to me when you're down. And I know for me, I had some health concerns and dropped quite a bit of weight. And all of a sudden, like, I was like listened to differently and spoken to differently. And so it was really eye-opening to me to see like how prevalent in our healthcare system the lose the weight first and then we'll kind of, look at everything else has become, when my numbers always came back fine, right? Yeah. And so thank you for that, because that was a moment. Now, you specialize in both weight management and helping people with diabetes. Yeah. So can you talk to me a little bit about that, and a little bit about kind of your full treatment plan? Because a lot of people think maybe being a weight management doctor that, I think our minds right nowadays go immediately to GLP-1s, right? Yeah. And so, but it's much broader than that in what you do. Can you share a little bit about how you work with people?
Yeah. So I tailored my practice to lifestyle changes and weight management, because 80% of the chronic diseases we see in the United States are due to our lifestyle, and another 80% is due to being overweight or obese. So by targeting these two areas, we can significantly reduce and prevent disease burden on patients. So my sort of practice is unique in a way that I spend at least an hour and a half, like we talked about earlier, just listening to my patients and getting attuned with their bodies to get an idea of what's going on. And we go into a lot of detail when it comes to the lifestyle. So what types of foods are they eating? How much are they moving? Sleep, stress, socializing, and if they're using any sort of toxic substances like smoking or illicit drugs. And then based on that data, combined with medical data, we're able to create a comprehensive treatment plan that involves not only making better lifestyle changes, but adding in some of these newer medications that you may have heard of on TV, the GLP-1s, including Ozempic, Wegovy, Mounjaro, Zepbound. And these aren't the only medications for weight loss. There are actually a whole slew of medications that have been out there for decades, and they've been used safely for decades. So by getting all the data and meeting the patient where they are, then we can make that decision on which route are we going to take. Are we going to use a GLP-1? Are we going to just try lifestyle changes first? Are we going to do both together? Or are we going to use an older medication? And through this method, thankfully, many of my patients have been able to come off of some of their other medications that were used for diabetes or hypertension or heart disease, because that lifestyle change and losing weight has significantly improved their health.
Gotcha. Yeah. So this is really interesting to me, because as your body is changing, right, then your diabetes medication has to maybe be manipulated as well. So do you do you work on your own to kind of help them make those adjustments to their diabetes medication, or do they need another doctor to do that as well?
Yeah, so my background is in family medicine, so I have a lot of training in diabetes management, hypertension, heart disease, and thyroid dysfunction. So because of all that training, I'm very comfortable making those adjustments to the medications that are used for type 2 diabetes, because it's amazing how much the lifestyle can change a person's A1C, which is a measure of their diabetes, and how much it can reduce that A1C. And as I'm watching my patients, I keep a close eye on that number as well through blood work. When I see it dropping, I do cut back on some of the type 2 diabetes medications to prevent potential drop in their blood glucose. So I do manage a lot of these chronic conditions.
Oh, that's awesome. So somebody can come to you and kind of have a broader and a fuller scope, rather than I know that there are some online places you can go, and that's kind of more of just a singular medication management versus a whole body process and a holistic approach.
Yes.
Okay.
Yes, absolutely.
Wonderful. Talk to me a little bit about some of the lifestyle changes that you implement, because sometimes I feel those sometimes feel a little bit a lot and a little bit heavier. So can you talk about what those are and how you can kind of help people to make those changes in their lifestyle manageable choices?
Yes. That's such a good point, because, meeting patients where they are, again, we live in a society that's built on convenience, and so we are consumers of fast food and foods that are readily available and you can just grab and go, right? unfortunately, all those foods are very processed and contain a lot of added chemicals and hormone disruptors and things that can significantly impact your not just weight, but your overall health as well. So I have this discussion with patients and they're like, yeah, but I have to have my bag of chips with my lunch. And, I love having a bowl of ice cream every night. And so I'm like, okay, let's just start with one small thing. Let's add something healing to your diet before we remove something that is toxic to your health. And so I tell people to fill their plates with fiber, add fiber. I'm a huge proponent of fiber, and fiber is found in fresh fruits and fresh vegetables. So we start with telling patients to add a half a cup of their favorite fruit or vegetable at least once a week and just increase from there. We'll start with once a week and then twice a week and then 3 times until we're all every single day.
So much more manageable and so much better than just like somebody telling you like eat better, eat more fruits and vegetables.
Absolutely.
And then you're beating yourself up for like not eating them because I'm like, today I didn't get enough. But like I thought you were going to say half a cup a day and you're starting someone once a week. And those things, right? Things with fiber fill you up a little bit more too. Mm-hmm. So then maybe over time, if you're putting those into your diet, then you're less hungry and less looking for those like fatty, rich foods that I love so much.
Yes, absolutely. Which are addictive, unfortunately. So one thing to keep in mind is foods that are full of sugar or anything that's boxed or packaged, they've made to be addictive in nature. And so as you're reducing these types of foods, you're going to go through a withdrawal and your body's going to be like, oh my God, I need a bag of chips. But I promise if you just, hold back for a couple of days, you'll overcome that withdrawal phase. And on the other end of it, you'll have so much more energy. So it's a process, and you may feel like, oh my gosh, I can't live like this for the rest of my life and not have a bag of chips. Get through that process of cutting out the processed foods and sugars. And then it's okay to have this stuff once in a while. Just don't make it a regular part of your diet.
Yeah, we kind of have to go back to, like, I know when I was younger and growing up, like those were treat items, not everyday items. Mm-hmm. And I think we've gotten away with that a lot, right? Because our lifestyles now, in some ways, almost demand it because everything's go, 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 go.
Absolutely.
And so you're not sitting down to enjoy a meal. Like I know if I sit down to enjoy a meal, I eat less and eat slower than when you're in your car and grabbing a sandwich and, eat, and then all of a sudden you're craving those salty foods and those kind of things.
100%. That mindful eating, it makes a huge difference. And it actually allows the body to digest food more readily. And it can also balance some of the hormones that are involved with digestion and storage and elimination.
Wonderful.
Yeah.
All right. So speaking of elimination, if you can't get your fruits and vegetables in, there are like fiber supplements.
Yes.
How do you feel about that? Like, do you feel like if you are to supplement with one of the kind of like fiber drinks, or if you take fiber gummies, like is that good, or should we really be kind of trying to lean on more whole foods?
I really push whole foods,
Okay.
just because a lot of supplements that are out there, they're not FDA regulated.
Right.
So we really don't know what is in those supplements, and they haven't been properly tested or evaluated to see what are the health benefits. And you can correct me if I'm wrong. Maybe there's a test out there, or maybe one of the viewers will find something in email later. I would love to see that data. But as far as I know, we don't have really good data on some of this stuff. So I always push whole fruits and whole vegetables first. Yeah.
I know that you also factor in sleep and stress with speaking with your clients. So before we move on, what everyone really wants to hear about, and I think that's how we're utilizing the latest drugs, but can you talk just quickly about some sleep and some stress items and how you kind of help people with that?
Yeah. When it comes to sleep, and I myself have been very surprised by this, but I would say at least 50% of the patients that I've seen, they have undiagnosed sleep apnea. And so some of the symptoms of sleep apnea is snoring or waking up very tired, waking up with a headache, waking up feeling like you didn't get a good night's rest. So that is a huge thing. And sleep apnea, basically what happens is you're not getting proper oxygenation at night because you're not breathing. Your body is stopping. It's not breathing, so you're not getting that proper oxygenation, and it causes micro trauma to all of the organs in the body. which results in things like diabetes, hypertension, heart disease, and obesity. So for a lot of people, by correcting that sleep apnea, they naturally lose weight. They naturally are able to reduce their A1Cs, reduce their blood pressure, reduce their cholesterol, just because their body wasn't able to heal. So that's a big thing that I would love for everyone to take home today, is to consider getting a sleep study if they have any of those symptoms: snoring, a sleep that wasn't restful, waking up with headaches, or if your spouse notices or someone around you notices that you're not breathing during sleep. Those are some of the symptoms to watch out for. And then stress management, it's a tough one because there are a lot of stressors around us. We're surrounded by a lot that isn't in our control, right? So you have to find what works best for you. And a lot of cases, therapy can be great for stress management. Many of my patients just spend more time outside, and that's what they use for stress management. Exercise is a great way to help manage your stress. So there are a lot of modalities out there, and I invite people to just try something, see what jives well with them, and just stick with that.
And if someone is coming to see you too, you'll have a conversation, and kind of based on where they are, then you'll be able to offer up that this may be a better route for them, that may be a better route for them in terms of stress reduction, whether it's meeting with a therapist or starting an exercise program.
100%, yes,
okay.
Yes, absolutely.
Wonderful. All right, so now there is a lot going on with, see, I always get A1C, GLP, Ozempic, all of that mixed up.
Acronyms?
Yeah. But so for some of your clients, they find that either they would like to explore medication as well, or maybe lifestyle isn't working on its own. So can you just tell us briefly a little bit about not A1Cs, about GLP-1s. And I'd love to kind of talk about some of the misinformation that's out there, if you can share some of that too.
Yeah, absolutely. GLP-1s are such a hot topic right now. I mean, you see it all over the news and social media, and maybe you may have a friend who's on a GLP-1 medication. And to be honest, they've been a game changer for a lot of patients who have done everything. They've done everything in terms of lifestyle changes. And the funny thing is, a lot of times doctors or other healthcare providers don't listen to the patient's story, or they don't believe the patient's story that I've done exercise, I've been eating healthy, I've been doing all the things I need to do, but I'm not losing weight. And this is where I think where GLP-1s are such a huge, huge benefit. They help in many different ways. We're still learning about how they work, but in one of the benefits of them is they help balance some of the hormones that come into play when it comes to weight gain and weight loss. And so through balancing those hormones, for a person who has done everything else, but their hormones were out of whack, that's why they couldn't lose the weight, when you add that GLP-1, they lose weight in an instant. It's like within 3 weeks, they're down 5, 10, sometimes 15 pounds, that's a lot, but that's just an outlier. But these medications, a lot of people think that they're a shortcut or an easy way out. They are not to be used as just a jumpstart. In most cases, these are long-term chronic medications that need to be monitored and used to maintain the weight loss and the other benefits that come along with them, including improvement in kidney function, liver function, reducing the burden of heart disease. So we see so many benefits that are there when used long term. So they aren't short-term medications, and they shouldn't be used without proper supervision. So it's important to work with someone who is watching everything very closely. I keep an eye on my patients every single week. I'm checking in with my patients. Okay. How's it going? What kind of side effects are you having? How are you responding to medication, and how we need to adjust it? So again, super, super important to utilize it under direct medical supervision.
Yeah. Well, and we're thinking about, I think a lot of people too are like, well, maybe are like, I don't want to take it forever. But my kind of mind goes to, we were just talking about diabetes earlier, and if you have type 1 diabetes, you take insulin forever, right?
Yeah.
And so that's how you can have the best quality of life. So to me, if you're taking a medication that's giving you a best quality of life, for some reason, when we have medications around weight, we stigmatize them in a different way. We also kind of, make you prove, right, that you've done all the other things. And we would never do that in any other situation, right?
So true.
I know, kind of similarly related to that, I work with a lot of clients that have not lymphedema, but lipedema, which is much different. And when you hear someone who's been diagnosed at like 40 or 50 years old, that went through their entire upbringing till that moment being blamed for being overweight, and then to find out that they have different adipose tissue that is causing them to appear to be a different than quote unquote normal, normal range. So I love that there are practitioners like yourself that are working hand in hand with clients. One, that's going to change the stigma around, one, the medications, how they're used and their purpose. And two, just making everybody kind of, healthier and the best self that they can be.
The reason I went to medical school, this was my dream to do something like this.
And we talk about that they're like new, but they've actually been being used for quite some time for diabetes.
So yes, so they've been out, Ozempic has been out for about 10 years now, yes. And we have a lot more data than we first started, but there is a lot of fear mongering out there in terms of some of the side effects that people have seen who are utilizing these medications. We're at a point now where there are certain things we are seeing. We can't determine what's causing some of the side effects and some of these adverse effects. So it's still, I would say it's still in a studying phase. We're still learning more. There's so much, there is a lot we don't know, but there is a lot we know. And with any of these medications, it's always looking at the benefits versus the harms. So is it more beneficial to take these medications to reduce the weight to prevent or reverse diabetes, hypertension, and heart disease, which in turn prevents or reverses hospitalizations and surgeries and even in many cases death? Or is there more harm to a patient who may not have any underlying conditions? They may not be overweight. They may be finding it somewhere online or who knows, wherever they're getting it. Then that's the situation where the harms outweigh the benefits and you're putting yourself at risk for some of these adverse events that we're seeing.
And this all goes back to what we talked about in the beginning, right? This is why a consultation and meeting with someone and having those conversations are really important. Someone who's a health professional like yourself, someone who's a doctor, preferably, because you're going to be able to go through that risk versus reward ratio to figure out what the best bet is for that person.
Absolutely.
Okay.
Yes.
All right. So we talked about a lot today. Is there anything that we missed?
Honestly, we did a great job covering everything. I am accepting new patients in my practice. I love working with people who are maybe tired of being in a system that sees them for 2 seconds and they're in and out. So I love sitting with my patients and just taking the time to learn from them like we discussed. And I love diving into the lifestyle changes and coaching every single week. I coach my patients. So, the way I am practicing medicine is very fulfilling for me, and watching my patients do better and feel better, it's been incredible. So I would love to offer services to anyone who's looking for someone who would like a holistic approach to their health.
Perfect. And full disclosure, we are work neighbors, so my office is right next to yours. But if someone's interested in setting up a consultation with you or an appointment or getting started, how can they find you?
So the best way is to go to the website, and at the very top there you can set up an info call and we'll have a talk and I'll go over how I work and I'll see if we're a good fit. In many cases I might not be the best fit, but I know a lot of people who are working in a similar sphere who may be the best fit.
It's one of the reasons why I wanted to have you on today is because I really respect that you'll have a phone call with someone, and if you're not the right fit, you do have other resources. It's really important to me in my practice, and I really appreciate that you do that in yours as well. Yeah. That is it for today. I want to thank Dr. Lina Kazi so much for really kind of educating us on so many different topics today. Body autonomy, as everyone knows, is really important. It's one of the main tenets in my business and on this show. So we appreciate your time so much today, and we look forward to seeing everyone on our next episode, which should be in a month from now that we're back on schedule. Until then, I hope you have fun with your fitness and enjoy the ride.